There we go. Perfect. I'll start by introducing myself and then I'm going to actually hand things off to Caitlin. So I already know some of you. I am Anna Golub. I wear a couple of hats in our program. One is the assistant PD for primary care for the residency, where I help coordinate primary care track education as well as continuity clinic education for all of our residents. And then one of my other hats is as the program director for our Center of Excellence in Primary Care Education Pathway, which is one of our clinical pathways based here at the VA. And this is the pathway we're going to be telling you about today in this session. I am joined by my colleague, Dr. Caitlin Harrington. Caitlin, I'll turn it over to you.
Thank you so much, Anna. I am really happy to be here to be talking to everyone about COE, which is a pathway which is based at the VA in Seattle. It's a fantastic opportunity, which is so near and dear to my heart. I actually was a trainee in this amazing residency. Anna was my mentor and paired attending in COE. And so very full circle for me. And I'm so passionate about this program. So I'm really happy to share a little bit about this with everyone. And I want to start by just showing a picture of our current trainees. This is from our last retreat in October. This photo shows our amazing medicine R1s, R2s, and R3s, all of whom are part of the University of Washington Internal Medicine residency, and our COE folks here. Also includes our colleagues in pharmacy, our colleagues in nursing, our colleagues in the nurse practitioner program, both residency and the nurse practitioner school at University of Washington. There's not a psychology trainee here, but we have an amazing psychology attending who is a really integral part of COE and was present at this retreat as well. So just want to sort of show that these people are so near and dear to my heart. They're really amazing. When we were thinking of COE and how to describe COE, we thought it would be helpful to sort of break it down into 3 distinct features. And I want to take a step back and say, what is COE? COE stands for Center of Excellence, and I'll talk a little bit more about it. It is a VA program which really focuses on interprofessional training and interprofessional training sort of across the medical spectrum. So along those lines, the first feature of COE that we really focus on are the opportunity to really practice medicine within an interprofessional team-based primary care clinic. If you come to the VA and you're in COE, you'll have 2 patient panels, and your panel is essentially the folks that you will follow through your 3 years of residency. So you will be their doctor. You will be who they think of as their doctor, and you will really have the opportunity to follow them through that time. And if you come to COE, you'll have 2 panels. One is in primary care clinic. This, you see folks across the spectrum. Anyone can be in the primary care clinic. There's also a women's clinic as well. And this is, again, it's a little bit of a misnomer because it's not set on a specific gender. But you will see a lot of female identifying veterans in women's clinic. And so it really gives you the chance to just become comfortable with primary care for all sorts of folks and really be able to support them on their journeys. That's the first feature of COE. The second feature is learning within an interprofessional environment. So the COE mission is really to teach trainees to lead and work in teams and to become really comfortable with thinking of your colleagues, not just as the other physicians around you, but as the pharmacist on your team, the nurse care manager on your team, the nurse practitioners you may work with, the psychologist. The VA has this wealth of resources that really allows for warm handoffs, wraparound care, team-based care. And so it's such a privilege to be able to learn medicine within that environment. And then take that with you when you graduate from residency, which I'm sure seems like a long time now, but 3 years can fly by. And then 3, when I think about sort of the unique features of COE, are the really unique tailored elective opportunities that you'll get within your 3 years here. So you have 2 electives each year. We'll talk more about it later on in this presentation. The first 2 are set for your intern year, but after that, for your R2, R3 years, it really is individualized for you. So how can we help you meet your objectives and your goals? So it's really pretty phenomenal to be able to shape your education that way. I'm really excited. And I should say that please stop me at any time with questions. I'm very happy to answer questions at any time. So starting with that first, what does it really mean to learn and practice within an interprofessional home clinic model? If you come to the VA, you'll have a panel. That panel is called the PAC team. So every primary care provider at the VA has a PAC team. You will be assigned a paired attending, but really the folks on your PAC are yours. That's your team that you work with and learn from and serve veterans with. The paired attending is nice because it's someone who can kind of cover you, say you're in the hospital, just sort of the realities of care. And it's also really nice to have a mentor and a partner in patient care. So I think, again, some really phenomenal learning opportunities. On the PAC team, and this is the VA model, it's pretty impressive, actually, when you think about it, the amount of resources we have. Every PAC team has an RN care manager, so a nursing manager. This is separate from the LPN, who will room patients and work very closely with you in clinic, for example, getting EKGs, asking questions of patients, things like that. You also have a pharmacist, and that pharmacist takes on a whole role of different activities. So they're extremely good, for example, at teaching you how to manage diabetes or hypertension. But they do other things too. It's really wonderful to have a pharmacist you can just Teams message at any time and learn from. So you get that support a lot inpatient, and I think bringing it to outpatient land is so unique and so valuable. You also have an administrative associate who can do things like schedule patients for you, call patients, remind them about labs, things like that. You have a social worker, which is huge because so much of what we see in primary care are just folks with really challenging social conditions. So at the VA, we have this wealth of resources, which I'll talk more about in terms of connecting folks with housing and different resources like that. So the social workers are very helpful with that. And finally, I would say almost most importantly, although everyone was equally important, but just so wonderful, we have same-day mental health support. So we have psychologists and psychiatrists who work every day within our clinic. They're a hallway over, which means that anytime you have a veteran who comes in who is requesting or really needs same-day mental health support, we have the opportunity not only to connect them with a visit that they'll have like right after your visit, but to physically walk them over to the mental health provider to do some team-based care and planning with that mental health provider before it, and really to offer folks this like wraparound care to make sure they get the resources they need. It's pretty phenomenal. I feel lucky for it every single day. So that's what PACT is in a nutshell. You
Caitlin, can I
need it.
just add one
Yes.
quick thing? Yes, just going back, I just want to emphasize too that the clinical pharmacists and RN care managers practice really independently. They see patients for their own visits who are on your panel to work collaboratively with you to help manage patients with chronic diseases. So really practicing at the top of their license, helping see folks between provider visits, and gosh, feel like an essential part of the team here. It's really, really wonderful.
They so are. I learn something every day from them. They're really amazing folks. So the veterans that you see at the Seattle VA, the veterans who come here are often very medically and very socially complex, which is just an amazing place, again, to learn medicine because you become very comfortable dealing with folks who have all sorts of things going on in their lives and also within their bodies. It allows for individualized training on providing the best possible care for these veterans. And you're able to do it within this really resource-rich setting. So a setting in which you can actually prescribe housing for someone. For example, you can connect them to housing resources. You don't need to worry about folks affording their medications. You can do all sorts of care augmentations, like say someone really could benefit from acupuncture or massage. You have the ability to do that, whole health, wellness. So the list just goes on. And it also really allows you to practice team-based care, not only with your PAC team, but with other social supports for veterans. So for example, if someone is living within VASH housing, which is basically supportive housing for veterans, and they would like it, the veteran would like it and requests it, their VASH social worker can come with them to visits. They can bring them to visits. They can really work with you to kind of strategize, how can we best serve this veteran? So just such a wealth of resources here. Anything else, Anna? Wonderful. So that's the first sort of set of what I think about with COE. The second, which really builds on this, is how do we teach you? So you're all physicians, which is amazing, but it is lifelong learning. I'm still learning, and residency is just this wealth of learning. So how does COE teach you to serve these veterans and to become such an amazing physician? And we do it in a number of ways. First of all, we have really innovative seminars and curricula that really serves you. One of the things that is sort of across all of these I am going to talk about is they are all interprofessional. So you are learning and being taught from the different professions I just talked about: pharmacy, nurse practitioners, nursing, psychology, social work. So it's really medicine. It's everyone working and learning together, which is really pretty unique. When you break it down on themes, we sort of have thought about this in 4 buckets. The first is really, how do we build teams and how do we learn how to practice collaborative care? How do we learn how to serve veterans and patients together as a team, all of us and different colleagues? So this can be things like meeting colleagues. For example, who are the chiropractors who are working within the VA? What resources do they offer? How do they think about different medical issues? It's really fascinating, and you learn so much from them, and that knowledge helps you then better serve your patients. The second thing is population health. So, for example, Anna and I just came from a really amazing COE education session on opioids and pain management and population health for those folks on your panel you are their physician while you're here. And so learning how so much of primary care is not what happens in the visit, it's what happens between the visits. And that's one of the really remarkable things about primary care, I would say. And the VA has amazing tools that allows you and your PAC team, which is fundamental here, your nurse care manager, your pharmacist, everyone on your PAC team, to really work together to serve those veterans. So the opioid management is one we just did. Hypertensive management is another. ED utilization is another. There's a whole set of curriculum around population health. The next is enhanced communication. And this is acknowledging that we every day go in, when every time you have a patient encounter, you are in this sort of sacred space of communicating with that patient. And sometimes it's challenging. Sometimes it's not, but sometimes it's challenging. And there are skills that we all can learn. Again, I feel like I'm learning this every day, that can help us better serve patients and better serve ourselves within these situations. One of them is conflict navigation that we did. We also did one on having crucial conversations. So really sophisticated training on communication. And then finally, we have integrated medical knowledge. And this is sort of all the medical knowledge that you need to be a good primary care physician, which everyone should be. Even if you go into hospital medicine, I love hospital medicine, but having this basis in primary care is so fundamental, I think, no matter where you end up, or specialty or anything. One of the examples that we have of the integrated medical knowledge was a workshop we gave on trauma-informed procedural skills for folks. And how do you do procedures, which can be really triggering for folks in the way that most honors them and respects them. There's the list of integrated medical knowledge is a long one, and I'm very happy to talk more about that offline as well. All right. Also part of this curriculum are trainee-led teachings. And this is fundamental because really, I think that everyone takes such an active role in their education. which is a great skill to have because once you graduate from residency, you are continuing to learn. So learning how to be a sort of a really active participant in gaining the skills you want, and teaching folks on your team. So for example, next year you will all be seniors and you'll have interns. You'll be interns this year, but that transition happens fast. So learning all of this is really a focus of COE as well. A few examples of this. One is a journal club, and this is where we have folks present different articles they've read that are really pertinent to care of veterans. And then we this year have had these amazingly sophisticated discussions, I would say, across professions from the articles. So really a great learning opportunity for everyone. The next is QI Works in Progress. So everyone within COE works with QI projects. For the medicine residents will be in your R2 year, and I'll talk more about that in a second. But the QI projects really work across professions as well. So we have pharmacy QI projects, we have nurse practitioner QI projects, we have nursing QI projects, we have psychology QI projects, and everyone really works together in order to sort of get ideas. So workshopping, for example, during the retreat we have once a year, folks who are starting QI projects spend time workshopping with the other professions about their experiences with this topic and how they sort of see it and their ideas for ways that that QI project could be structured. It's really invaluable because it's breaking down the silos which can form and really allowing you to kind of see the whole picture, which is amazing, and build community, which is always good. I think community is fundamental to everything. So the R2 QI projects, are for the primary care folks in their R2 year. And I just want to preface this by saying that this slide is sort of about the primary care folks, but we have a number of trainees who are in QI, who are in COE, who are categorical. So this does not mean that you have to be in the primary care track to be in COE. We would really welcome categorical trainees, residents who are interested in learning more about COE as well. But this is for the primary care folks. So everyone in the primary care track, your second year will have a whole month focused on QI, where you learn sort of how do you do a QI project. And then you have the opportunity to apply that knowledge into really helping to improve work within your own clinic. So this happens within the VA as well, for the VA primary care folks, that you all work together on one QI project together. And just some examples, because we've had some really amazing QI projects that come out of this, which are really exciting. We had one last year that was focused on how do we increase prescribing within the Seattle VA? Because the VA actually has amazing PrEP resources, but it felt like there could be more uptake of that. And so the group there who you can see here, you can see Joe and Anna, who are both third year R3s right now, and I'm really happy to say both will become attendings here at the VA next year, talking about their QI project. We also had a QI project talking about how do you improve transitions of care following hospitalization. And this is really kind of unique in some ways at the VA. The transitions of care is an issue everywhere, but the VA is almost like a one-payer system. It really just is, where it's all located within the same spot. Your team's messaging when someone's primary care patient is in the hospital, you can team's message with the hospitalist, they can reach out to the primary care doctor. It's really integrated. And so we were trying to leverage those resources to really try to make this transition, which can often be bumpy, despite the best of our care, as smooth as we could. This year, the QI project that the residents were working on was a really exciting one, which was actually a continuation of a year or two prior. So really leveraging the work that had already been done and moving it forward, and talking about how do we mitigate the systems contributions to racial disparities and hypertension control. So how do we try to improve this? And knowing that there's systemic racism, how do we try to decrease this? It's pretty amazing project that people are working on this year. The projects often continue for 2 years. So you start at the fall of your R2 year when you have this dedicated month, which is, again, this really unique opportunity during your residency, but often they progress for 2 years with opportunities for publishing, for presenting, and moving things forward. So really pretty amazing. There's always additional opportunities for quality improvement work as well. The VA has just a wealth of that and really always welcomes folks to participate. Okay, so number 3, now we're talking about some of these unique COE elective rotations. And like I said, every year you'll have 2 months of these rotations. In your R2 year, those months are set, but they are pretty phenomenal months. So the first one is working with Simha Reddy, who's one of the physicians here, who's sort of like how I hope to be a primary care doctor, is what I would say. He's very inspirational. It is care for veterans experiencing homelessness. The VA has an amazing resource which Dr. Reddy runs called HPACT, which is basically a PAC team, like I was describing, that goes out into the community and cares for veterans where they are. So they go out to the different shelters in town. They will go drive to someone's van and deliver insulin. The examples go on and on. And when I did this years ago now, but when I did this and when I talked to each set of trainees who go through this, it really, I would say, brings back why often people wanted to be a doctor. It's just this very sort of soul healing experience where you have the opportunity to take care of veterans in this really unique way. So that's one of the electives. I will say that you don't need to be a COE primary care resident to do this elective, but it's very sought after. So being one of those residents allows you to have a spot because it is such an amazing month. The second is equally really unique and cool, and this is primary care telemedicine with rural sites, as well as sort of matched with deployment health. So one of the things about the VA patient population is it's really quite rural. I would say that it's almost like practicing rural care within an urban environment. So when I think about my own patient panel, a lot of folks live out on the Olympic Peninsula, which is quite west of Seattle, or they might live all the way up by the Canadian border, or they might live pretty far south, or some of them even come from Eastern Washington. So you really are having the opportunity to practice this really rural medicine. In addition, we have community clinics. And so this is an opportunity to sort of get an experience about what is it like caring for veterans in a community clinic, for example, in Silverdale, which is out on the Olympic Peninsula, or in Port Angeles, different places like that. It also incorporates telemedicine, which in the COVID, sort of post-COVID, I don't know if really post-COVID, but in the past 3 or 4 years has become really fundamental. In sort of the height of the pandemic, this is how a lot of medical care was done. And I think although it is not good for everything, people did realize that it was a resource that could be leveraged. So for example, say you have a veteran who was 200 miles away and gas prices just make it prohibitive for them to drive down for a 30-minute visit. You can learn how to do video visits with them. And you would be surprised how much you can gain from a video visit. Again, it's not for everything, but I would say it's a really fundamental skill for practicing medicine now. And I don't think that's going away. I think that is staying. In addition, deployment health, the VA population is a very unique population. These are folks who volunteered to serve their country, who volunteered to go serve in a war zone. And a lot of that comes with scars. So people come back and they are wounded. They're wounded, their bodies are wounded, and it's also very hard on your psyche, your mental health. And so it's such an honor, I think, to learn how to serve folks who have done this and how to now sort of help them. So that is also part of the R1 curriculum. The next 2 years are very individualized. There's 2 rotations per year. And what will happen is that one of the attendings here, Dr. Takahashi, will reach out to you before your schedule, or after your schedule is set, but before it's when you know you have those COE blocks, and ask you, what do you want to learn? what would be really interesting for you? What would be most valuable for your care? So again, really taking that ownership over like shaping your own training in some ways within this like kind of envelope of amazing mentorship. Some options that folks have done before, one set of them really focuses on advanced skill sets and environments of care. So this could be a clinic systems leadership, working with the leaders within the clinic. How does a clinic run? It's not always intuitive, and it's an amazing set of skills where you can really get that one-on-one mentorship. There's a whole month you can spend as a clinician educator as well. So in this month, you work with teaching medical students, with mentoring R1s, with sort of learning how to teach. There's VA also has an amazing PAC team, which is a home-based primary care team, which is a whole another set of folks, including physical therapy, occupational therapy, primary care providers, pharmacists, nurses, psychologists. There's more, I'm sure, who all go out to veterans' homes. So these are for folks who are very medically and socially complex, who are essentially housebound. But here, the VA comes to them. So being able to learn that is almost an old-fashioned way in some ways of practicing medicine, but so incredibly valuable. So you can spend a month with a home-based primary care team learning how they practice medicine and going out to folks' houses with them and giving them medical care there. There's also another set of this, which is specialty and topic focused. And here the sky's the limit. So really, if you want to learn something, I am pretty darn sure we can help you learn it. But some options or sort of ideas that folks have done. They've worked with rehab medicine. They've worked with deeper knowledge of women's health. They've worked with palliative care, neurology, urology, sort of sports medicine, MSK, cardiology. We have amazing gender affirming care as well as really strong addiction medicine located both within the primary care clinic. And then there's also a whole separate addiction medicine clinic within mental health as well. So just many layers of support for veterans and opportunities for learning and for taking care of patients, veterans for trainees. Okay. And then finally, but not least importantly, almost most importantly, is community. I think coming out of the COVID sort of years, we have all realized how essential community is, both in terms of learning and then just joy in practice and joy in life outside of medicine. It's just having a strong community is essential. So we really do everything we possibly can to build this community with you. And it's a really cool community because it's a community within your residency, which is phenomenal, and with the folks who are based within COE at the VA. But it is also a larger community of all the other trainees within COE. And so it's a community of pharmacists, of psychologists, everyone. And I have to say that now as an attending at the VA, I still call in that community all the time because folks tend to like it so much, they tend to stay. So I will be messaging with someone who I trained with, who's a psychologist, who's a pharmacist, who's now running the PrEP clinic here or the travel medicine clinic. So it really gives you these amazing relationships which continue on. One example of this is the retreat, which I talked about, which is a full day that will be blocked from your schedule. So no matter where you are that day in October, if you're inpatient, someone will cover you and you'll have this dedicated time to focus on building community, which is so important. In that retreat, we also do things like workshop the QI projects, like I talked about. And then again, really working with trainees about how can we make COE the most valuable for you. So defining new directions for COE as well. Okay, so just very briefly, so the Center of Excellence is a program that came out of the VA. I want to say maybe 10 years ago now, maybe not that long, roughly 10 years ago. It was really unique when it started because of this interprofessional lens in terms of learning and practicing medicine. And so because of that, folks really wanted to make sure that it was successful and that it was accomplishing what it had set out to do. And so it was evaluated just like we do in academic medicine. We sort of test things, we evaluate things. And what was found was pretty phenomenal. So there were very high levels of satisfaction among folks who were training within it. People felt like it really improved their chances of finding employment, becoming really good healthcare providers, no matter where they went, learning really valuable skills. So that's from a trainee perspective. Just as important, probably more important, is how was COE for veterans? Because really the reason we are all doctors is we have chosen to be healers, to work with patients, to serve patients. And so how were we doing that? And the exact same thing was found. So when they evaluated different PAC panels, so COE PAC panels versus non-COE PAC panels, but at the VA, they found that there was improved A1C control, improved renal testing, more timely mental health visits, fewer ED visits. So I would say the care across the spectrum is really fantastic at the VA, but the COE is really special. All right, now what I want to do is show you guys a video. So let me stop my share that was produced a couple of years ago from our amazing COE graduates, in which they essentially kind of explain to you why they love COE. So let me do this now. Bear with me. You think I would be very facile at this by now? Here we go. And then share sound and make big. And it's only about 3 minutes.
The VA COE pathway because I really love their vision of interdisciplinary healthcare and a team-based approach to healthcare.
Hi, my name is Mary Davies. I'm a third-year resident in the COE track. I chose COE for a few reasons, but I think the most important was just a sense that the COE team really cares about primary care education.
Hi, I'm Anna, and I'm one of the second-year residents in the COE. I really want to do the COE because I love the VA, I love the patient population, I love all our attendings in clinic, and I love how much interdisciplinary work we get to do.
My name is Joseph Martinez, and I'm a 2020 graduate of the internal medicine residency program there at the University of Washington. After doing a bunch of second looks throughout the country, I happened to come to the COE when they were doing a panel management day, and I will tell you I was completely sold. Being a primary care clinician, having time to do quality management, and also being told that it was so important was very key to me to making that choice.
Hi, I'm Cody Gearing. I'm a Medicine R2 in the COE track. Going into primary care, you know, it's so crucial to be able to work within a functioning team and be able to utilize all the resources available. I felt like COE was a good opportunity to get better at that during my training.
Physicians really are just a small piece of the equation. Our work would be impossible without the nurses and social workers, the amazing mental health team, and the pharmacists that we get to work with. It's incredibly rare to have the opportunity to also train alongside people learning in those professions, and I think it's both been really helpful and also incredibly enjoyable.
Hi, my name's Mindy. I'm a second-year resident in the COE program. The best part of COE is the people. I love my co-residents. They're so much fun. I love learning from other trainees in the program as well and learning from our amazing faculty.
Definitely my co-residents. I'm so lucky to be with Mindy and Cody. It's just been a blast.
I'm still planning on going into primary care. I'm about halfway through my R2 year now. Certainly it could change at the last minute, but I think this has mostly reinforced my interest in going into primary care.
I'm doing an addiction medicine fellowship next year and planning to do a blend of primary care and addiction medicine. Addiction medicine, like primary care more broadly, really relies on interdisciplinary teams. I think that COE really helped me realize how much joy I find in practicing medicine in that framework. And I think it's a really crucial tool for providing high quality and equitable care.
After residency, I would like to still be a primary care doctor. I would love to continue taking care of vets if I can. COE has definitely only made that much more clear to me. Strongly encourage everyone to apply to COE.
Excellent. Let me stop that share.
Hi, my name is
Yes, that is, sorry. Give me 1 second. Let me turn this off. Okay, great. So let me share my screen again with the slides.
While Caitlin's sharing that again, I just want to mention that the folks in the video have gone on to do wonderful things. So Cody Gehring is now our new director of homeless healthcare up at our Everett VA clinic. Mary Davies is working at the Yakima Valley Farm Workers Clinic, which is an FQHC in the Yakima region in central Washington, caring for the population there with both primary care and addiction medicine. Mindy took on a primary care job at PacMed. And I also just want to shout out, we've had several COE grads go into subspecialty medicine. We have one who is a current HEMONC fellow here, one who's going to be applying to Palm Creek Care Fellowship. So the interprofessional team-based and leadership skills are so broadly applicable, regardless of specialty that you're heading into. Back to you, Caitlin.
Absolutely. It was so fun to see that. They're just such amazing people. All right, so we've reached the end. So in summary, the COE pathway really provides this amazing learning opportunity, including, but I mean, this is by no means in sort of the whole list, but it has complex chronic disease management. You'll have a patient in women's clinic as well as primary care. You have very strong integration with mental health, addiction medicine, homeless health, home-based primary care, gender affirming care, telemedicine, population health QI, leadership, medical education. The list really goes on. And really, I'm just so excited about COE. Huge congratulations on matching. I think you are going to have an amazing 3 years. I'm really looking forward to meeting you, no matter what. And please reach out with any questions. I'm happy to answer the questions myself. If you'd like to talk to a current COE resident, I'm happy to connect you. They have offered to do that. So just let us know how we can be helpful. And Anna, I'll turn it back over to you.
Yeah, we can take questions now if you have any. And just as a process check-in, if you are curious about applying to COE, there's a place to denote that in the survey that you got from the program today with your continuity clinic sorting goals and learning goals. And please also email me and Caitlin so we can tell you more about the program. It's also pretty flexible in terms of people tailoring some of the rotations we didn't mention. One person who's going out to practice rural primary care wanted to get some more ICU and hospital experience. And so they chose to do an ICU rotation in one of their COE electives. So really it's quite flexible, just to let you know. Yeah, as you mentioned, Caitlin, really sky's the limit when you think about what's best for you. We're happy to answer any questions.
I had a question about the women's clinic panel. Is there still opportunities to get certified for like Nexplanon and IUD placement?
Yeah, that's such a great question, Madison. You know, um, it is variable in our women's clinic attendings who has those skills. If it's something that a trainee is really particularly interested in, it's something that we have worked to explore with we have OB/GYN department here at the VA who really does full-time gynecology. We have 3 colleagues and they practice out of the same clinic. They're a potential resource to provide that training. Our director of the women's health program here, Dr. Ashbaugh, is a family medicine physician who also has that skill set. And we also have another family med doc who does a lot of precepting with our NP residents who have the skill set. And so it would be one of the things that we would achieve through the individualized training opportunities within the COE rotation set. And I will say, all that being said, if you're interested in women's health, as a COE resident, you'll probably get the most exposure to women's health of our different clinics and pathways, second to the women's health pathway. So really, it's a very robust exposure to a broad spectrum of women's health here at the VA, which I think surprises a lot of people who are familiar with VA. It's not the picture that many people would have in their mind about VAs. Great question. Other questions?
I have to head out, but thank you so much for walking through this for us. I really appreciate it.
Absolutely. Well, thanks to all of you. We want to respect your time. We know it's late. It may be late where you are, but email us if you have questions down the road. We're happy to answer those, or as Caitlin said, connect you with residents in the pathway. So take care. Great to see you all.
Congratulations.
Yay.
Celebration.
Yeah.